Is mold making you sick? Could it be the cause of your mystery autoimmune disease? Well, it was for me, and some experts estimate that 20% of the population could be struggling with mold toxicity and not even realize it. I recently figured out that mold was the cause of my chronic illness that I've been struggling with for the past 4 years, and I'm currently on an extensive treatment plan to get better. If you're new here, I have a degree in science, and I enjoy doing research on topics and reporting them.
Planet New Podcast. This is the journey of setting yourself free.
Okay, so diagnosing mold toxicity. How do you actually get diagnosed? So this can be difficult as many doctors are still ignorant when it comes to mold toxicity, and some will write it off completely. Because you can't see mold, it's easy to think that it's all in your head and that you're being paranoid. I think everyone with SEERS has been there, but there are tests that you can do, so just trust the process. I would highly recommend seeing a specialist mold doctor as they will believe you. You can see many online, telehealth, and they will know exactly what to test for and how to treat it. Okay, so the HLA-DR gene test. So probably the first thing you want to do is get the HLA-DR gene test. So make sure you don't get the celiac one. But 25% of the population have this gene, and it makes them more susceptible to mold poisoning. So that's not even that's 1 in 4. It's not like a crazy small number of people. It's 1 in 4 people have this gene. So it costs about $200, or it can be bulk billed in Australia. So the test results usually take about 10 business days to come back, and you may need to get a specialist doctor to interpret the results. My GP couldn't do it. It's pretty confusing. There is a website that allows you to calculate your results in Australian format. And if that fails, there is a paper by a shoemaker that you can use. I've put both of these links on my website, which is in the description. So the gene can test positive for mold susceptible or multi-susceptible. So a person who tests positive for multi-susceptible, it means you're susceptible to multiple threats, including mold, ticks, E. coli, and more. This is the gene that I tested positive for. I also tested positive for the chronic fatigue susceptible gene, which I didn't even know that was a thing, but that was very validating considering I have chronic fatigue. Separate to the gene test is mold allergy test. So even if you don't have the gene, you could have a mold allergy, an IgA, or a mold intolerance, IgG, which both are detected through a normal blood test and can be bulk billed. Visual VCS test. So another test you can do online and at home is the visual VCS test. So this test is good because it will give you a good indication immediately and for free online. So as the mycotoxins from mold can cross the blood-brain barrier, mold affects brain function. So this explains the symptoms of memory loss, poor concentration, losing my train of thought. It also affects contrast visibility. And so almost all people with mold poisoning fail this test. So the patient looks at a series of alternating white and black lines, and if they can't see them, this indicates poor retinal function, which is closely linked to biotoxicity. It sounds simple, but in the field, it's widely accepted. Okay, mycotoxin urine test. There is some debate about using this test. So this test screens for many different types of mycotoxins, and it can be useful if you need to prove to someone that mold is in your system, such as a landlord or a boss. It costs about $400 in Australia through Nutripath, and some doctors like it because it can show you exactly what types of mold are in your system and making you sick, and then you can target them for treatment. Dr. Neil Nathan talks about this in his book Toxic. I really recommend this book. It's probably my favorite. But he says that different types of binders will bind better to different types of mold. So if you know exactly what type of mold you're sick with, you can, then curate your treatment plan and use this binder to treat it more specifically. However, some doctors don't bother with this test because it's so expensive. They believe that this money is better spent on treatment, and there's other things you can do to confirm that you have more toxicity. The test can also be inaccurate, and it doesn't screen for every type of mycotoxin. And also some patients seriously compromise the ability to remove toxins from their body, which means that the test can come back as negative, even if it's, truly positive. So to combat this, Dr. Neil Nathan suggests that patients should take 500 milligrams of glutathione, hope I've said that right, twice a day for a week leading up to the test, and then doing a urine sample 30 minutes after a sauna. I went down the path of not getting the test. I thought it was better to spend that money on, the treatment. Okay, blood tests. So Dr. Shoemaker suggests testing for the inflammatory markers that usually go array when dealing with mold toxicity. So these include VIP, MSH, leptin, and more. There are other tests that can indicate mold illness, including a full blood count, liver function, lipid profile, immune markers, and many, many more. But this is way out of my league. You should talk to a specialist doctor about this. I'm going to have Dr. Kate Barry on my podcast, so listen to that.